Download your favourite apps with Huawei Petal Search. Download now.
Thank you, Mr. Speaker. To the Prime Minister, does she stand by her statement that the reason the government will not extend the wage subsidy to cover the additional 4 days of lockdown is because, quote, it would require an entirely different process and regime, end quote?
Mr. Speaker, that wasn't exactly my quote, but on Monday I was asked why we didn't just tack on an extension to the 2-week wage subsidy. My reply to that question was, quote, it is not a simple exercise to simply tack on additional. It would require an entirely new application processing regime. Our focus is getting the money out the door quickly for everyone who's already applied, close quote. Mr. Speaker, as a Cabinet, we also weighed up a number of other factors when considering the 2-week wage subsidy that has been applied across New Zealand. That included that Auckland has had a combined lockdown at level 3 and 4 in total of around 9 weeks, and the wage subsidy has been available for 22 weeks in total, far exceeding the level 3 and 4 levels. In addition to this short 2-week extension, thousands of additional businesses have become eligible for the 8-week wage subsidy payment as a result of the shorter lockdown. The other financial support the government is offering was also considered, including the Small Business Cash Flow Loan Scheme, tax changes and specific sector support packages. And Mr. Speaker, finally, we also considered the fact that we do need to manage the government's finances responsibly. Every dollar in wage subsidy is unfortunately a dollar that is also borrowed.
To the Prime Minister, is she in essence saying it's just too hard?
Mr. Speaker, I refer to the answer I gave in my primary, which is no.
Is she saying that workers could lose their jobs just because the government thinks it's too difficult to extend the wage subsidy for 4 days, and anyway businesses have had enough help?
Speaker, that's absolutely not what I'm saying.
Well, then what is she saying?
Mr. Speaker, I'm saying that we have considered that over the level 3 and 4 period, which has been the most constrained, that is equated to about 9 weeks of constraint, particularly for the Auckland region. But the wage subsidies that have been available now total 22 weeks. It's also worth considering, as I acknowledged in my primary answer, and we did consider this, some businesses would not have been previously eligible for the wage subsidy extension. Keeping in mind that is an 8-week payment. A number of businesses, because of this more recent lockdown, are now eligible for that 8-week payment. In fact, Mr. Speaker, we have received in the order of 37,000, if I recall correctly, applications for the wage subsidy extension. That demonstrates businesses are actually accessing 8 weeks of support in some cases, not just 2.
Does she understand that the wage subsidy does not actually end up with businesses because it is for the subsidy towards wages for workers, and that businesses who have been in lockdown do in fact have other costs as well as wages to pay when they've got no income coming in?
Speaker, of course we have kept that in mind all the way through, which is why we've also had access to things like the no interest business loan scheme, and why we have put in place initiatives to reduce tax liability also for small business.
Does she agree with Professor Nick Wilson from Otago University, who said, quote, "We must have had some failure at the border. It's unlikely there could have been silent transmission for that long," end quote. If not, why not?
Mr. Speaker, I agree with him that it is unlikely that there could have been silent transmission for that long, and ESR analysis supports that to date. However, that does not necessarily mean there has been a failure at the border. As I said on 15 July, when announcing our resurgence plan, quote, "We only need to look to Victoria, New South Wales, Hong Kong, Singapore and Korea to see examples of other places that, like us, had the virus under control at a point in time only to see it emerge again. This does not mean anyone has failed. It means perfection in the response to a virus and a pandemic is just not possible," end quote. There are a number of ways the cluster originating at Americold could have entered New Zealand. To date, we have not established the source of the cluster, but we are working hard to investigate all possible options.
Prime Minister, does she agree with Professor Des Gorman, who, following the recent revelations that 63% of border staff were not routinely tested, said that the community, quote, deserves better than such a casual approach to surveillance to possible infectivity among the border workforce, end quote? If not, why not?
Is again trying to imply that without any evidence that that is the source of the outbreak. I again point to the fact that the vast majority now of our border staff, our MIQ staff, those at ports, have been tested. And to date, Mr Speaker, we have not found the source of this outbreak. And for the member who is pitching in, the ESR evidence demonstrates that the genome sequencing suggests the source of this outbreak was in very close proximity to the first cases, thus demonstrating that it's not a matter of there having been necessarily a case that was not picked up.
To the Minister of Health, how many people in managed isolation have not had day 3 tests since the week of 8 June?
Mr Speaker, I thought the question was a bit longer than that. No, it's been edited. Mr Speaker, the vast majority of people want to do the right thing and agree to get tested at day 3 and at day 12. So far, 20,065 day 3 tests have been completed since the 8th of June. During that same time period, 19,473 day 12 tests have been completed, and there are currently 5,204 people in managed isolation and quarantine. There are some instances...
Order. Member will resume his seat. I've warned members about that interjection, which is a reflection on me and my responsibilities. Mr Goldsmith will withdraw and apologise.
I withdraw and apologise.
Mr Speaker, there are some instances where it's not appropriate to test a person with a swab, such as young babies who are 6 months or younger. The number of people leaving managed isolation or quarantine without a day 3 test has not been collated and reported in that way, because before people can leave managed isolation, they must return a negative day 12 test. I'm advised that only 15 adults have refused a day 12 test. That means that they can be required to stay up to 28 days in managed isolation.
Is he really telling New Zealanders that the government cannot count the number of people who entered managed isolation and subtract the number who were tested at day 3?
Mr Speaker, no. I'm saying that we don't routinely measure the number of people who hadn't had day 3 tests, because it's not the most important consideration when it comes to our public health response. The key question that people should be asking is, are people being released from managed isolation at risk of taking COVID-19 into the community? Because they get a day 12 negative test before they are released, they are not. With regard to those people who are in managed isolation, everybody who's in managed isolation is treated as if they have COVID-19.
Parliamentary. Does he agree with reports that thousands of people have not been tested at day 3 in managed isolation since June 8?
Mr Speaker, the numbers simply don't support that claim.
Parliamentary. How many people in managed isolation have tested positive at day 3, and how does that compare to the number who've tested positive at day 12?
Mr Speaker, I think the number that the member would be most interested in is that of the people who have tested, there's 14 people who have tested positive on the day 12 tests. Of those, 12 people had a negative day 3 test. Only 2 of them didn't have a day 3 test, and those were people where they had their day 12 test shortly after we had introduced the mandatory requirements around the mandatory testing regime.
Parliamentary. Have the majority of positive coronavirus tests in managed isolation been at day 3 and not at day 12?
Mr Speaker, yes, that would appear to be the case, yes.
The Right Honourable Prime Minister.
Supplementary. Can the member describe for the House the purpose of the day 3 test from the government's perspective and a public health perspective relative to the purpose of the day 12 test, which is primarily, of course, to ensure public safety?
Mr Speaker, the day 3 test is primarily to ensure that people who have COVID-19 who are in a managed isolation and quarantine facility are getting the support that they need for that. There is very little risk to the public health from a positive day 3 test because, as I've indicated, everybody who is in managed isolation and quarantine is treated as if they have COVID-19 until such time as they get a negative day 12 test before they are released into the community.
If the majority of tests in managed isolation, positive tests in managed isolation, have been at day 3, doesn't that justify the importance of compulsory testing at day 3?
Mr Speaker, the importance of compulsory testing at day 12 is to ensure COVID-19 doesn't move out into the community. Day 3 tests, which as the numbers have indicated, the vast majority of people are doing, help us to better serve the needs of the people who are in MIQ.
Does the modelling that the Director-General used at a recent media stand-up to justify the current policy settings at the border require compulsory day 3 testing? And if so, has the government made serious border decisions on a modelling assumption that now turns out to be wrong?
I'm not sure I follow the question. Can I get the member to repeat the question?
Does the modelling that the Director-General used at a recent media stand-up to justify the current policy settings at the border require compulsory day 3 testing? And if so, has the government made serious border decisions on a modelling assumption that now turns out to be wrong?
Mr Speaker, no, and I do want to remind the member opposite that it was only 3 weeks ago he was accusing me and the government of subjecting people to medical procedures in managed isolation and quarantine that they didn't consent to.
Parliamentary. Will he require testing in managed isolation to be compulsory at day 3?
Mr Speaker, the current requirement is that it's mandatory at day 12 before somebody is released, and I have no intention of changing that because the public health grounds to do so would not be strong enough.
Download your favourite apps with Huawei Petal Search. Download now.